We don't believe in outsiders. Here, we stand together. We bring one another strength. We search for answers that don't yet exist. And if we can't find what we need, we build it.
Welcome back. That was a clip from a powerful new commercial spot in support of CAMH's No One Left Behind campaign. It's the world's largest fundraising campaign to support hospital-based mental health research.
Here to tell us more about this important initiative, please welcome CAMH senior scientist and the inaugural Treliving Family Chair for Women's Mental Health, Dr. Liisa Galea. Thanks for being here.
Thanks for having me.
CAMH, for people who don't know, it's the Centre for Addiction and Mental Health, and it is Canada's largest mental health teaching hospital and really one of the world's leading research centres in its field. So why is their No One Left Behind campaign so important?
Well, we're facing a global mental health crisis at the moment. In Canada, 1 in 5 of us experiences mental illness, but by the time we're 40 years old, it's 1 in 2. So that's 50% of us have had or experienced mental illness. And that's why I'm so surprised and astonished that it still has such a stigma, because we all know and love someone that has experienced mental illness. And so the campaign, the No One Left Behind campaign, is to raise $500 million for life-saving new research into mental health disorders, as well as a new research and discovery center.
Let's talk about that center, because the renderings of the new Research and Discovery Center in Toronto look absolutely incredible.
Beautiful.
We'll take a look at a few of them here.
Yeah.
So how do buildings like this help advance mental health care?
Yeah, so right now, I know it's beautiful, isn't it?
Beautiful.
Right now, CAMH is on 2 different campuses. The main one is on the Queen Street West location, but many scientists and researchers are at a different location many kilometers away. It's a bit of an old building, really hard to meet people and collaborate with people. Why is that so important? Mental health disorders are complex. As I like to say, if it was simple, we would have figured it out already. So we don't know where the next great discovery is coming from, but we do know that diversity breeds discovery. And diversity in terms of who we invite at the table, but the disciplines that we invite, it's people with lived experiences, psychiatrists, neurologists, psychologists, and other researchers, neuroscientists, all need to become at this table to advance mental health research. Mm-hmm. And so that's why it's so important to have this new building.
Yes. So as you say, we're experiencing a global mental health crisis right now, and I think we can think all of ourselves about some of the reasons for that, but talk about why you think that is.
Yeah, well, the obvious one is the COVID-19 pandemic. All of us, it was like, I'd say, a perfect storm for mental health challenges, right? So many of us lost jobs, but I think it also bared witness to all the inequities that there are in the world in terms of our supports that we need to do our work in this life. So we did a survey. It turned out that, and it's probably going to be no surprise to anyone, that the people that said that they were more likely to be depressed and have anxiety and have more stress were women and gender diverse individuals during this time period. So that's why it's so important to do their research on health equity, who's falling behind, and that's why this campaign is so important.
Mm-hmm. Well, Dr. Galea, you are a senior scientist at CAMH, but your focus is on women's mental health specifically. Can we talk about sex hormones for a second? Because how do they, in your research, actually affect our mental health more specifically? And how does that then differ from, for example, a man's experience with mental health?
Yeah, there's so many things I could talk about here, but we do know that who gets different disorders is very dramatically different between men and women. So boys, for example, are more likely to be diagnosed with autism. Women are more likely to be diagnosed with depression than men are. But it goes beyond who's getting it. It's also how it manifests. So the symptoms can be very different between men and women, boys and girls. And that suggests that treatments need to be different too. In terms of sex hormones, the time of greatest risk to develop depression in a person's lifetime is postpartum. Pregnancy associated with huge changes in hormone levels, really high, then they're withdrawn from the postpartum period. So these sort of hormonal transition times are times of high risk in a person's lifetime to be diagnosed with psychiatric disorders. And there was a study that came out a couple of years ago. They looked at over 1,000 different diseases, and they found that women had a delay in diagnosis of 2 years or more for the very same disease. It suggests that we need more research into why that might be.
I mean, that was my next question. Is that's a significant lag in time, which means a significant lag in help for her. So what are some of the reasons that you can think of that it takes 2 years plus for a woman's mental health illness to be diagnosed?
Yeah, I think there are many reasons, but the big one to me is that most of our medical knowledge, and in fact how we diagnose different diseases, has been based on men and male physiology. So much so that women are said to, for a variety of diseases, are said to have atypical symptoms. Like atypical for whom? Not obviously atypical for the woman or gender diverse individual that's experiencing that illness. And so that's why, again, the research is so important to understand the health inequities, particularly in mental health, and how that might manifest differently. And so we can diagnose people earlier.
So if you could give women one piece of advice to help protect our mental health and prevent future issues, what would that be?
One piece of advice would be exercise. I know it's not our favorite thing to do, but there's really great evidence to support that. It doesn't have to be a lot. You don't have to train for a marathon. It can be as little as 10 minutes a day. Do things that interest you, like dancing, yoga, walking the dog. You can even do weights while you're watching your favorite TV show. There's great evidence that it supports sleep, reduces your stress, and there's another acronym, if I can bring it in, it's DRESS. So all of these we know support your mental health, diet, reducing your stress, exercising your body and mind, as well as social support and sleep.
I love a good acronym. We will, every darn time I'm in, and I won't forget that now. Okay, so let's talk about part of the fact that the mental health crisis, at least in this country, is partially due to lack of access to care. This is a big country, and so you have remote communities. You have communities that don't even have doctors, let alone mental health professionals. So if someone is needing help, and it's very hard to access care, I mean, what kind of advice can you give them if they don't have a CAMH, which is like literally down the street from here, for example?
So first of all, I'll say I think the world needs CAMH and its research now more than ever. Research is going to help us find those new and innovative ways to diagnose disorders. It's going to find that personalized treatment. It's going to give us those tools that we need to prevent mental illness even from occurring. And research, it takes time, but we will get there. And it doesn't just affect us locally, it affects us nationally and globally as well. But obviously, if you are experiencing or know somebody who's experiencing mental health distress at this moment, really important to talk about it. Talk to your family and friends, talk to your healthcare provider. If you don't have a family physician, go to a walk-in clinic, go to emergency. The more we talk about it, the less ashamed we are, the less stigma there is around there. And the more we realize mental health is health.
Mental health is health. Great note to end on. Dr. Galea, thank you so much for this discussion and also all of the important, vital work that you're doing for mental health and especially women's mental health. We really appreciate it. Thank you so much.
Thanks for having me.
So we hope you get and we're asking you to give as much support as you can to the No One Left Behind campaign. We'll be right back after this.
Thanks for watching. We've got lots more discussion and debates on everything from food and fashion to pop culture and current events. Don't forget to click like and subscribe.